I had a student ask, how do I find the correct working end in the posterior? We're going to look at the upper right buccal first. Now notice, if I fly in like this, it's hard to tell. Is the instrument wrapping? Is the lower shank parallel to the long axis of the tooth? If you're coming in sideways like this, it makes it very difficult to tell. So instead, try coming in like this. What a lot of people will tell you is that the V, the little arrow, should be pointing to the distal if you're on the posterior. What does that do? It allows for your lower shank to be parallel to the long axis of the tooth. That is the correct working end. So some of the tricks, people will say the V to the D. That means the V, the bend in the shank to the distal area, okay? The other thing you can do, if you are just hell-bent on coming in sideways, then the arrow should point down if you're on the upper arch. For the lower arch, the arrow should point up. So think of it like a little rooftop on top of the house, right? Then when you stand up on your fulcrum, notice the lower shank is parallel to the long axis of the tooth. It doesn't matter what trick you use to figure out the correct working end in the posterior. What matters is that you understand the terminology. The lower shank is parallel to the long axis of the tooth. Why? Because on an exam, a written exam like your national board exam, they're not going to ask you which is the correct working end, right? And they're not going to ask you something like that. They're going to ask you, how do you know you've chosen the correct working end in the posterior?